Hi, Ale. Good afternoon.
Hi, teacher. How are you?
Very fine, thank you. How is everything there?
It's okay. It was raining this morning.
And now in the afternoon?
And now it's
Okay.
it's um crazy
Weather, right?
weather.
Yeah, that's for sure. Here it was sunny in the morning, and then started to rain just 40 or 50 minutes ago, but so hard. So it's a little bit crazy. Hi, Belen. Good afternoon.
Hi, Michelle. Good afternoon. Hi, Ale.
Hi, Belém.
Okay. Okay, let's wait a little bit for Vanya, I think. And if not, Lily is not gonna make it today. So I think we can start in a few seconds, okay?
Okay.
Okay. Can you see my screen?
Yes, Miss.
Okay. I will take this. Okay, today we're gonna start with systems, diseases, and symptoms. I'm pretty sure you're so very comfortable talking about these topics because I know you already know. The only thing we're gonna do is just remember, okay, and try to learn some words in English. So, where is my presentation? Oh, I'm sorry. Okay. So, Ali, can you read this paragraph for me, please?
Sure. Describing problems. The problems which a patient reports to the doctor are called symptoms. For example, pain or nausea. Signs are what the doctor finds, also known as findings. On examination, the patient, for example, high blood pressure or a rapid pulse rate. Symptoms are also known as complaints. The report or a patient's symptoms or complaints, doctors say. Mr. Farnsworth was admitted complaining of chest pain. In case notes, the abbreviation CO is used. CO, chest pain.
Okay, thank you very much. So, as you know, we have signs and symptoms, right? And I know that you are pretty near from this definition, or it's a little bit different in your cases. Are you okay with these definitions? Or you have another definition to describe symptoms and signs?
No, I think it's fine.
Okay. It's so easy, right? There are some problems with which patients report to the doctor are called symptoms. For example, pain or nausea. And signs are what the doctor finds, also known as findings or examination the patient. For example, high blood pressure or a rapid pulse rate. I don't know, but because of the little time we have to make an attention, especially when we have a lot of patients waiting for us, we have to find a way to make it faster and easier for us to understand in a way that we can make a description after to feel the evolution and the medical history, right? That's why we usually use, oh, I'm sorry, I don't know what happened. We usually use these abbreviations. I don't know in your if you do it in your cases.
Yes, we use abbreviations too.
Okay, can you give me an example of your abbreviations for instance?
Okay, like surgery, it's abbreviation like CX or hypertension. I don't know how to say hypertension arterial.
Hypertension.
Okay, that's like HTA, something like that.
Okay, that's so good. And you, Ale, how about you? Do you usually use abbreviations?
Yes, I use SX to talk about science.
Okay, okay, that's so good. So I think this part is pretty much understand. Okay, and then we have the presentation. Belen, can you read this part for me, please?
Okay, presentation. Patients said they went to see the doctor. Doctors say the patient presented. The symptom which causes a patient to visit a doctor or to present is called the presenting symptom, presenting complaint, or presentation. His present His presenting symptom was chest pain. His presenting complaint was chest pain. He presented to his GP with chest pain. The usual presentation is chest pain.
Okay, it's like a game with our tongue, right? Okay, then we have patients say they went to see to the doctor. Doctors say the patient presented, okay, the symptoms, which causes a pain, a patient to visit a doctor, or in other cases, to present, and is called the presenting symptom, okay? Talking about a symptom that is presenting the patient. So the patient is presenting complaint or presentation, talking about the symptom, okay? We can use those in these ways. And we have more specifically here in these boxes. His presenting symptoms was chest pain. Okay, you are describing right here. His presenting complaint was chest pain. You can use both of them. He presented to his GP with chest pain. And the usual presentation is chest pain, talking about in general, right? So I don't know if you have any doubts here.
No, miss.
Okay, I think
Okay.
it's pretty much understood with these boxes, right? Perfect. So we have here talking about symptoms. So we're gonna read one by one. The first line, the first box, we'll read Belen, then Ale, then me, and then we'll start again, okay?
Okay. Tiredness, lethargy, fatigue, lassitude is a symptom, and the meaning is loss of energy. The patient says, sorry, I feel tired all the time. I feel completely worn out. Lately, I have been feeling completely exhausted at the end of the day.
Okay,
Um,
thank you.
Malaise, general feeling of pain unwell. I feel unwell, I don't feel well. I have been feeling off color for 2 days. I haven't been feeling myself for a week. I have been out of sort all day.
Okay, and we have anorexia, and that the meaning is loss of appetite. Patients may say, my appetite is very poor. I've been off my food for days.
Weight gain, increase in weight. I have put on 8 kilos in the last year. I have gained 5 kilos. Yes, 5 kilos.
Okay,
Weight loss, decrease in weight. I'm not eating any less than usual, but I have lost a lot of weight recently.
and we have constipation, meaning hard, infrequent feces. And patients say, my motions are very hard. I've been quite constipated lately. I'm not very regular. And we have the note about the verb feel is also used with other adjectives such as hot, cold, nervous, anxious, dizzy, weak. Like she said, she felt dizzy. Okay, it is an example. So we can find in this box a list of symptoms, right? That you can use when you are talking about a patient. And the meaning could be just as short as you can see here, but patients may say a lot of things that can find a meaning in this short phrase. Okay, so I don't know if you have any questions about vocabulary here.
Not miss.
Okay, so I think you pretty much understand. Like, for example, faces or motions are almost synonyms, right? You can use both to express the same thing. Okay. What about you, Belen? Are you okay with vocabulary?
Yes, yes, miss.
Okay. I think you can, I don't know, take a pic of this box or you have in your book. It will be so helpful for you when you are talking about any disease or describing any signs or symptoms of your patients. Okay, so let's practice, okay? Let's play a little bit. Read the patient's description of her symptoms when complete the case report. So we have to read this box and then we complete the other box. Okay, so Belen, can you read this box for me, please?
Okay. I was well until a few months ago. In the beginning, I just felt off color and a bit tired, but lately I've been feeling completely worn out at the end of the day. I'm not eating any more than usual, but I have put on 9 kilos in the last year. My motions are hard and my hair has started to fall out.
Okay, so I think we can understand what she says, right? Then we have the other box. A 50-year-old housewife who had been well until 4 months previously. Number one, what would it be the answer about their description? Oh, her description, sorry. You can, if you want, I can go back. I feel, right? Remember, I feel tiredness, maybe. Yes. I feel full of tiredness. And if you want to have both boxes um, in your screen, or maybe you can, are you with your books on a side?
Yes.
Can you find this box? Is the case number 13, sorry. Maybe trying to describe. Come on, guys. About this box. What is she feeling?
What was the page? Sorry, miss.
Is the case 13? I'm not pretty sure about the page right now. But don't worry. Let's just make the exercise with our imagination, okay?
Okay.
Trying to find out. We have here a description of the patient. And in this other box, we have to say, how is she feeling? Okay? So let's try. We have this one here. When I know, for example, that these are synonyms: tiredness, lethargy, fatigue, lassitude, okay, loss of energy. Malaise, general feeling of being unwell, anorexia, loss of appetite, weight gain, increase in weight loss, decrease in weight, constipation, hard and frequent phases. Using this, we're gonna fill in this box. Okay?
Okay.
Then we can say in number 1,
I feel completely of tiredness. Oh, I feel, I don't know what to do with the of.
we can say that she, because it's a case, right? A 50-year-old housewife who had been well until 4 months previously. She's been feeling out of
She's feeling
tiredness and malaise. We can say that, right? Because she felt bad. She felt unwell, right? Or maybe with lassitude too. Okay, I think we're gonna have a little bit time here. Then this will be our homework. Okay?
Okay.
Okay. So
Okay.
case 13. Finishing the class, I will find out the page and I will tell you what is it, okay? But this will be our homework. Let's continue then. Blood. Can you read this? Oh, sorry. Please, Belen.
Okay. Full blood count. In the investigation of blood diseases, the simplest test is a full blood count, FBC. A full blood count measures the following in a sample of blood. The amount of hemoglobin, I think. The number of different cells, red blood cells, I don't know how to say that, erythrocytes.
Yeah, that's right.
Okay, white blood cells, leukocytes, and platelets, thrombocytes. Okay. The volume of the cells, the erythrocyte, I don't know.
Erythrocyte sedimentation.
Sedimentation rate, measurement of how quickly red blood cells fall to the bottom of sample blood.
Okay, thank you very much. Don't worry. We were gonna try to find out the correct way of pronunciation, the correct meaning of the words, okay? And if we find out something that we don't know, you don't know, and I don't even know, so we're gonna find the answer together, okay? I think you're pretty much understood what is every single word, right? Or there is something you want to clear here in about vocabulary?
No, miss.
It's okay, miss.
Okay. Very good. Please, can you read this, Ale?
Yes. Anemia. Bleeding, loss of blood. Excessive destruction of Z cells. Low production of Z cells.
Okay, that's so good. So can you tell me how many kinds of anemia we can find?
A lot of ferropenic, megaloblastic, I don't know how to say it in English.
Yeah, it's okay.
Aplastic anemia,
Okay.
I don't remember.
This is a little, it's like a little game, okay? What is the name of this kind of anemia? When excessive destruction of red cells appear.
I think it's hemolytic anemia, right?
Okay. Then we have the other kind, a low production of red cells.
It's aplastic anemia. I don't know.
What do you say, Ale?
Yes, I think it is.
Okay, very good. And what happens when bleeding happens, loss of blood? What kind of anemia is that?
Ferropenic anemia.
Yeah, that's so good. Okay, so you perfectly gained the 3 boxes. Point for you guys. Okay, we have here. So who's gonna be the professor and who's gonna be the student? Maybe Ale, you're gonna be the professor, and Belen, you're gonna be the student. It's okay?
Okay.
Yes.
Okay, go ahead.
What's the most likely diagnosis in this case?
Most probably carcinoma of the bowel with chronic blood loss.
What's against as a diagnosis?
Well, he hasn't had any change in his bowel habit or loss of weight.
What else would you include in the differential diagnosis of severe anemia in a man of this age?
He might have leukemia of some sort or aplastic anemia, but that's rare. It will be very unusual. Another cause is iron deficiency, but he seems to have adequate diet.
Okay, now, there is another cause of anemia which I think is more likely.
Chronic bleeding ulcer?
Professor?
Yes, that's right. But what about permission anemia? Can you include that?
Well, he's got none of the typical neurological symptoms like paresthesia.
Okay, that's good. Okay, we can find here a medical student that has examined an elderly patient with a very low level of hemoglobin and is discussing the case with her professor, right? So, do you understand everything or there is something you cannot get and do you want to make me to explain?
It's fine.
It's fine, teacher.
Okay. I'm pretty happy that you can understand everything. So we're gonna go to this next game. No, just kidding. No more games. Okay. So we have pernicious anemia. Jordi, the medical student from Barcelona, has made some language notes. I'm pretty sure you make notes too, right? We talk about abbreviations lately. So I think you make this kind of notes. And for that reason, can you read the first part? Maybe, no, can you read everything? Please, but from this side, Ale, and Belen, you can write the right side.
And sure, pernicious anemia is a condition in which there is atrophy of the gastric mucosa with consequent failure of instinct factor production and vitamin B12 malabsorption. The onset is insidious, with progressively increasing symptoms of anemia. Patients are sometimes said to have a lemon yellow color owing to a combination of pallor and milk jaundice caused by excessive breakdown of hemoglobin because of ineffective Z cell production in the bone marrow. A red sore tongue glossitis is sometimes present. Patients present with symmetrical paresthesia in the fingers and toes, early loss of vibration sense, and progressive weakness and ataxia. The spleen may be palpable.
Thank you. The spleen, just that, okay?
Thanks, Miss.
No problem. Then Belen, can you read the right side, please?
Okay. Onset. Oh my God, I can't read. Wait.
Oh, I'm sorry. Yes, I know. This is a problem. If you
Beginning? Begin?
can you read it?
I think it says beginning, right? I don't know. Onset,
Yeah.
yes. Beginning, yes. Insidious, slowly developing. Pallor, lack of color. Mild or mild? Mild?
Mild.
Mild, okay. Slight. Jaundice, bilirubin. How can I say it in English? Bilirubinemia?
Bilirubinemia.
Bilirubinemia. Breakdown, division into smaller parts. Bone marrow, soft tissue in the cavity of bones. Symmetrical, each side the same. Vibration sense, ability to feel vibrations. Progressive, continuing to develop. Palpable, can felt with the hand.
Okay, thank you very much. I know it's so hard for you. You cannot see very good. Okay. So we have these, maybe some words you cannot understand for the writing here. And we have onset like a beginning, right? Like the start, okay? Can you understand this word now?
Yes.
Yes.
Insidious, slowly developing, okay? Then we have pallor, lack of color. Can you make a translation of this word?
Pálido.
Yeah, palidez, okay? Then we have mild or slight. Do you understand this?
No, not really.
Mild can be understood as an icteria, okay? It's like loss of color. Can you understand now?
Yes.
Okay. Mild. Then we have bilirubinemia, right? But we can say bilirubinemia, okay? Jaundice. Now, if we're talking about mild jaundice, we are speaking specifically of ictericia leve. Can you write down that in order not to forget this word or this phrase? Then we have breakdown. There is a division into small parts or smaller parts. And bone marrow. In the meaning is soft tissue in the cavity of bones. I know you know the word in Spanish.
Médula ósea.
Yeah, that's so good. Symmetrical. Each side is the same, right? We can understand that. Vibration sense is the ability to feel vibrations. Progressive is continuing to develop. And palpable, something that can be felt with the hand, right? I don't know if you have any doubts here.
No, miss.
No, miss.
Okay, perfect. Then continue to the bones. Some common English names for bones. We have here the name in English, right? And we have on the right side the anatomical name. Then we'll find skull, and we can say that it's the cranium too. The jawbone or mandible, spine or vertebral column, the breastbone or sternum, the rib or costa, the collarbone or clavicle, the shoulder blade or scapula, the thigh bone or femur, the kneecap, we already seen it, right? Or patella, the shin bone or tibia. Okay, I don't know if you have any doubts here. I think you can understand the words, but if there is something that you don't understand, just tell me, okay?
It's fine, Miss.
Perfect.
It's okay.
Okay, Ali. Oh my God, you won't see my little pictures, but we can find this on the book too. Okay. Then we will go to fractures. Did you have the chance to work on emergency areas?
Yes, Miss.
So I think you saw a lot of accidents, including fractures.
Yes.
Okay, what about you, Ale?
Yes, Miss.
Perfect. So I think it will be easier. Okay. Then we have this kind of fractures in bones. We have a green stick, okay, a displaced one, as you can see, displaced one, comminuted in a lot of parts, impacted, you can see here, is not a displaced, but it's a fracture, an open one or compound that you can see from just taking a look, right? A fracture is a broke in a bone, some of the different types. A pathological fracture is a fracture in a diseased bone. A fatigue or stress fracture is due to repeated minor trauma. For example, long distance marching or running. It can be happen in these ways. But sometimes, or most of the times, these fractures are because of accidents, right? Can you give me some examples? I don't know, where we can find this kind of fracture community, for example?
In a gun impact.
Okay. And a displaced one?
In a car accident.
Yeah, that's for sure. An impacted?
When you fell from high places.
Okay. What about you, Ale? Do you have any examples for these fractures?
Yes, but I have the same examples.
Okay. About a compound or open, when we see these ones?
Maybe in, I don't know, an accident of car or something like that.
Yeah, it could be. And this green stick?
We see that in pediatrics.
Okay. It seems to be the hardest for me. I don't know. Because kids are so, I don't know, crazy, and maybe with pain, they cannot stand, right? How do you manage this kind of problems? I know maybe the traumatologist will make his job, but you can manage at first, right? What do you do, guys, if you were the one who is attending this kind of patients?
Can mobilize the patient, but there are fractures that heal really fast. So yes, the moment it's a little bit complicated, but then they still calm. Well, when I saw these patients, they were crying, but they were really calm. I don't know if Ale has seen the crazy boys.
Yeah, I thought they got crazy because of pain. Okay, that's pretty good. Then we have the treatment of fractures, right? Can you read these two paragraphs, please, Belen?
Okay. When the fragments of a broken bone heal and join together, they unite. Union may be promoted or helped by reducing the fracture, replacing the fragments in their anatomical position if they are displaced.
Excellent. And Ale, can you read these two paragraphs, please?
Sure. After reduction, excessive movement of the broken bone is prevented by fixation, either external, for example, a splint or plaster of Paris cast, or internal for example, a pin or a plate and screws. A displaced fracture which is not reduced may result in malunion, incomplete or incorrect union.
Okay, thank you very much. And we have a note here. The verb reduce has several meanings in medicine. It can have this meaning, to make smaller. And the example may be, I think with better reduce the dose of your tablets. In surgery means to return to anatomical position. A hernia can normally be reduced by manipulation. In chemistry, to remove oxygen or add hydrogen. Okay, nitric acid is a reducing agent. So don't forget that this verb reduce has this kind of meanings. Okay, and those are their examples. Here, I don't know if you have any questions. Do you remember what a splint means?
No, miss.
It's like a férula, right? Remember we talked about a few classes ago? So don't forget, férula. It's very common to use in this kind of treatments, right?
Thanks, miss.
No problem. Then, I don't know if you have any questions.
No, miss.
It's okay.
Perfect. Do you remember we were someone asked me how do you say yeso? I think it was you, Ale. This is
Yes.
plaster. Plaster is the meaning of yeso, okay?
Thanks, Miss.
Okay, let's continue then. Okay, so we have find the last thing. I don't know if you have any other questions here.
No, Miss.
Okay, so that's pretty good. Then, when we have to describe, oh, who is it? Oh, hey, Vania, how are you?
Miss,
How are you? Good afternoon.
sorry, Miss.
Don't worry. But we were getting to the final of this presentation. Maybe we're gonna make a little resume, okay, for you. And then we gonna solve some doubts that can be on the air. Okay, we were talking about some types of description of signs and symptoms. As we can say, as we can see, we can say his presenting symptoms was chest pain, or his presenting complaint was chest pain. It's almost the same. We're talking the same aspect, okay? He presented to his GP with chest pain. We can say the usual presentation is chest pain. Those three ways of presentation are okay. If you have any question, Vania, you just ask me, okay? I'm gonna make it in 15 minutes that we have left. Maybe this box will be useful for you. We were talking about the symptoms we can find in our patients, maybe tiredness, and their meanings will be tiredness, lethargy, fatigue, lassitude. The meaning is loss of energy, okay? And the patients usually say, I feel tired all the time, or I feel completely worn out, or lately I've been feeling completely exhausted at the end of the day. And all these complaints we can find here to describe tiredness, lethargy, fatigue, or lassitude. Okay? Then we have malaise, another symptom, and the meaning is general feeling of being unwell, like malestar. Okay? And the patients say, I feel unwell. I don't feel well. I've been feeling off color for 2 days. What was the lack of color or off color? Do you remember, guys? We already talked about this. You forgot, guys.
It was pálido.
Yeah,
Pálido.
but what it was, how was the in English?
Oh my God. I don't remember.
Pallor. Pallor.
Pallor.
Okay, we're gonna get there, but don't forget this time. I've been feeling off color for 2 days. I haven't been feeling myself for 2 weeks. I've been out of sorts all day. Okay, that's malaise, general feeling of being unwell. And you can find them because of the patients will describe it in this way. Anorexia, that is loss of appetite. And patients may say, my appetite is very poor. I've been off my food. I've been off my food for days. Then we have weight gain, that is increase in weight. Patients say, I put on 8 kilos in the last year. I've gained 5 kilos. Okay. Weight loss, that is a decrease in weight. And patients say, I'm not eating any less than usual, but I've lost a lot of weight recently. And we have constipation. The meaning is hard and frequent feces. Patients may say, my emotions are very hard. I've been quite constipated lately. I'm not very regular. Okay. And we have a little note here. The verb feel is also used with another adjectives, such as hot, cold, nervous, anxious, busy, and weak. We can find an example. She said she felt dizzy. And I don't know, Vania, if you have any questions here of vocabulary, maybe.
No, no, miss. It's okay.
Okay. Do you understand faces and motions like synonyms? We can use these words. Maybe in context you understood, right? Vania, it's okay?
Mm, the context of my emotions are very hard.
Yeah, talking about constipation. When patients are describing, my emotions are very hard. They are not talking about her emotions, okay? Motions are feces. Do you understand the word feces?
The position.
Yeah, that's good. That's another way to say it. So it's good. You find another way to explain this. Those can be used as synonyms, okay? Perfect. We have this little game, but we were not in a mood to make it right. So this is our homework, okay? This is gonna be our homework. The case 13. Okay, I'm gonna send it to you by inbox in the group so you can practice. You will read this first box and then you will fill in the blanks with the correct description or presentation, okay? Let's go with blood. We have a full blood count. In the investigation of blood diseases, the simplest test is a full blood count, FBC. Okay, a full blood count measures the following in a sample of blood. We have the amount of hemoglobin, or we can find the amount of hemoglobin. Then we can find the number of the different cells, red blood cells, erythrocytes, white blood cells, leukocytes, and platelets, thrombocytes, okay? We also can find the volume of the cells and the ESR, the erythrocyte sedimentation rate, okay? Measurement of how quickly red blood cells fold to the bottom of sample of blood. I think you can read the blood test, right? And you can find if your patients have a common diseases like, for example, anemia. We were talking about anemia, and we can find a lot of kinds or types of anemia, right? Uh, what was the name of this kind of anemia? Excessive destruction of red cells. Do you remember?
Hemolytic.
That's
Anemia
good one. That's good. Then we have the low production of red cells. What is the name of this?
maybe aplastic anemia.
Yeah. And the last one, the bleeding loss of blood. The most common one. Someone can help?
Ferropenic anemia.
Okay, thank you very much, Belen. And we have this one. No, let's go here. We have the pernicious anemia. That is a condition in which there is atrophy of the gastric mucosa with consequent failure of intrinsic factor production of vitamin B12, malabsorption. The onset is insidious with progressively increasing symptoms of anemia. Patients are sometimes said to have a lemon yellow color owing to a combination of pallor and mild jaundice caused by the excessive breakdown of hemoglobin because of ineffective red cell production in the bone marrow. A red sore tongue or glossitis is sometimes present. Patients present with symmetrical paresthesia. Paresthesia. I'm sorry, I cannot see it either. In the finger sense and progressive weakness and ataxia. Okay, the spleen may be palpable. And we have here the meanings of these words. We have onset, that means beginning. We have insidious, that means slowly developing, okay? We have pallor, what we were talking about, that is a lack of color. Mild, that is a slight, and jaundice, that is a bilirubinemia. But we have a mild jaundice. Those words together will mean like ictericia, okay? But in a slow level, or ictericia leve. We have a breakdown that it means a division into smaller parts, a bone marrow, that is the soft tissue in the cavity of bones. Do you remember what you said in Spanish? What was the meaning? Ale, Belén.
Médula ósea.
Médula ósea.
Okay. Very good. We have symmetrical, that each side is the same. Progressive, that is continuing to develop, and palpable, that can be felt with the hand. Okay, we have a lot of slides forward, but we don't have much time to explain again the things. So I can invite you to watch the YouTube video, Vania, and or the link I will send to the group. Okay?
Okay, Miss.
I don't know if you have any other questions.
No, maybe
Well,
when I read.
okay. I'm sorry, I cannot hear you well. Can you fill the little questionnaire for me, please? Okay, thank you very much. I hope you could understand this part. If not, please go again to the YouTube video, or to the link I will send to you, because Ale couldn't make it either. Okay? Okay, guys, see you tomorrow. Who's gonna be first tomorrow?
Tomorrow it's Saturday, so we're gonna have.
I'm sorry, Monday.
Okay.
I'm just getting used to it. Okay, who's gonna be first for Monday?
Okay, Miss.
I think we have a little trouble with the internet. Can you write on the message side, please? Okay. Any problem with that? Okay, Belen, you're gonna be the first. The second one? Okay, Ale and Vania, can you be the third one? Is it okay for you? Okay, perfect. Then see you 6:15 and 6:30, Vania, okay? Okay, thank you very much for your time. See you on Monday. Have a good weekend.
Thank you, Miss.
Bye,
Goodbye.
guys. Take
Goodbye,
care.
girls.